So, ladies, if you would share a little bit about who you're caring for, what kind of dementia, if you know what's happening, and what you do or have done in your life.
Um, I have moved in my mother's home, my 89-year-old mother, who was diagnosed with cognitive loss
Okay.
a little less than a year ago. And
Okay.
my husband and I moved into her home when we began to see her struggling with some of the aspects of just managing her day-to-day routines. So
And
we've
she's
been in,
widowed or
she is widowed.
okay. So,
Yes. Her husband, my father, had passed away about 4 years ago.
okay. So she's living on her own until you moved in.
Correct. Yes.
Okay.
With us intermittently checking in on
Mhm.
her either by telephone or in person.
And you're still working or not
I
working?
had recently cut down from full-time work to PRN
PR.
as an occupational therapist. And
Okay.
more recently, I've even surrendered the PRN
Okay.
because at this point in time, it doesn't feel safe to have
Okay.
my mother alone for any amount of time.
Okay.
It's that just in case
Kind of
situation
thing.
where if
Okay.
something were to go wrong, it could get bad. So it just feels safer to always be around at
Okay.
this point in time.
Okay. Thanks.
So I'm Mary Arthur, and I was a caregiver for my grandmother, Margaret, who passed away with early onset Alzheimer's in her 60s. And then I became a professional caregiver, and then a PAC trainer and consultant, and started educating on memory loss and brain change. So I've been in the field for about 20 years since that situation, but it's still very raw.
Okay. So, granddaughter
Yes.
and early onset Alzheimer's.
Yes.
Okay.
Hi, I'm Crystal. My dad was diagnosed with FTD about a year and a half ago. He is struggling with his cognitive, um, everyday life um, abilities. And it wasn't until they diagnosed him that I said, can he get an assessment from a neurosurgeon? Because I need to know exactly, what I need to look at, what I need to work on. I am in education. I've been in education over 20 years, but this is not my field. So I've been trying to learn as much as I can.
And
I'm the caregiver, sorry, for my
so,
dad.
so you take care of your dad.
Yes.
And dad's still married or?
Yes.
Okay.
Yes. And we live together.
So you live together.
Yes.
Okay.
Yes.
Yeah. So all three of you, child, grandchild, child, that responsibility, that role. Do you feel like you stepped into that role voluntarily, or do you feel like that was a role that people expected you to step in, and so that's how you got in the role?
I think in my particular case, it was just by default.
Okay.
I have a brother who lives in New Mexico.
Mm,
And so him being so far away, I think that it just sort of naturally came to me.
came to you.
And we saw that coming,
Okay.
years ago.
Okay. So it was just sort of a pattern that continued. Does he support what you do, or does he stay out of what you do, or do
He
you all have
supports what I
conflict?
do in
Okay.
so much as he trusts it to me.
Okay.
He asks to be kept informed,
Okay.
but he certainly is supportive of the decisions that I make.
Okay. Great. Now, Mary, for your grandmother, was that a choice or was it expected, or how did you move into that role?
I watched my grandfather struggle. My grandmother became the opposite of who she had always been and wandered and became pretty violent. And so I kind of just fell into the role. I've kind of been the caregiver since, like the family caregiver. And there's over 80 of us. And I watched everyone deal with it very differently. And now I understand a lot better that every family deals with it differently, every individual. So.
Yeah. So, yeah. So,
So
Crystal?
I'm the caregiver because one, I was living with them for about 2 years before he was diagnosed. And we moved together because I was sick at one point and I couldn't drive and I couldn't clean and I couldn't do those things. And my parents would come over every day, every day. And so it came to as everyone has had a problem with rent increase. So we decided to move together. And that was great because they're older. and they were coming to see me, who is younger. And I thought that was going to be it's too much. It was too much on them. So we moved together. And then probably 2 years later, I was taking care of my dad. So I don't feel that it's by default. And by the way, I don't work. I retired, disability. So I don't feel it's by default. I feel it's my responsibility as his daughter, who doesn't work, who can do, and it's my responsibility.
Are you the only child?
No, I have a brother.
You and your brother same page or different?
No, I'm the oldest by 5.5 years. But he works. His wife works. His daughter is in college. My son lives in New York. My daughter lives in Providence, Rhode Island. So, ding, 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 I'm the winner.
Ding, ding, ding.
I enjoy it. I know having dementia and living with it is extremely hard. But I still feel it's my duty because my parents took care of me.
Okay. So do you get support from your family? What decisions you make and how you do that? Or is that supported, or is there friction in that
No, and
relationship?
I'm glad
or-
you said that because I did make a decision one time about the driver assessment because he wanted to drive. And so the doctor said, if you pass the assessment, you can drive. Well, I said, okay, I called and paid for it, and they had $1,000. I was excited. And then my family said, you did not have to do that. And you do not make any decisions without us. So after that point, every decision has been made together. And we moved because he could not walk upstairs. And that was the decision we all made. And again, my son lives in New York. My daughter lives in Providence, Rhode Island. Thank God for technology and videos and photos. So it was an agreement that this was the place. So since then, we've been making decisions together, and it has been great. It really has been. It hasn't been any friction or, anyone getting mad and not calling anybody anymore. But it's really been good, and I know that's something that's not in all families. So I treasure that.
So for you, having joint sort of collaborative decision making, that's a good plan for you. That works well for you. You solo or collaborative decision making for your mom?
My husband is very, very supportive.
Okay.
So it would be fair to say that we're probably partners in it
Okay.
all. And I have an advantage in the fact that he's a physical therapy assistant, and so he's worked in the long-term care setting, the skilled care setting. He's encountered
Okay.
dementias, cognitive issues in his patient population, same as I had, and
Right.
so that I think helps.
Helps. The same though, or not the same at all when it's a family member?
Different in a lot of ways. Different in a lot of ways. But he's ultimately supportive of me.
Of you. Okay. Yeah. Mary Arthur, back when you were the primary for your grandma, independent decision making or collaborative, or everybody having opinions and thoughts?
There was a lot of opinions and thoughts, but ultimately my grandfather was the decision maker. But he really struggled with those decisions and didn't want to see her pass and not eating. And it was really tough. And it was a lot of just support from, I feel like, me and my uncle and all of us to get him to accept where she was.
Okay. So being a grandchild, a little different maybe than being the child?
Yes, I believe so.
Okay. Yeah. So in all dementias, each dementia is so unique. But in general, typically we find the rhythm of language is often available longer and more effectively than the specifics of words and speaking and how to communicate. So, with the person that you're supporting, what have you noticed about what's retained in both sort of the rhythm of talking, but also the desire to express how they're feeling about something or what they want, but maybe the words are not always 100% on target? What have you noticed about?
In my case, I've certainly noticed that my mother has the word finding difficulties,
Mm-hmm.
but it's still easy to read her face.
Mm-hmm.
And even as she's verbally expressing herself, I may not find it logical in my world, but I can always agree with her emotions. And it seems like in the end, that is the best thing that I can do for her. So whatever she's trying to express, be it frustration, be it agitation, be it fear, I can agree with her emotions, and that really
Do
seems to
you
calm her down.
use more facial communication skill, or are you still using a lot of language as you're working with her?
I find it better not to throw a lot of words at her for a couple of reasons. One, she's unfortunately very hard of hearing,
Okay.
which doesn't help.
Mm-hmm.
And she also has macular degeneration, so she's got central vision loss. So it's
Right.
a combination
Mm-hmm.
of
Tone of voice, rhythm.
my affect,
Mm-hmm.
really impacts her, I think, probably more than anything else.
Okay, so working on how you're feeling before you're trying to engage her
Correct.
and noticing when you're starting to feel differently
Yes.
and pausing, is that sort of a strategy, or are you still working on
It
that?
has become one.
Okay.
Because in the past, I found myself in a situation where she was becoming upset about something. It was her medication.
Mm-hmm.
She had gotten her medication regimen a bit confused.
Uh-huh.
She thought that medication she'd always taken in the evening now had to be in the morning.
Mm-hmm.
And I approached that situation from, well, I've got to fix this. She needs to take her pills at night. That's what the doctor said. So I've got to correct her course on this. Well, that did not go well.
Uh-huh.
And I could not employ logic with her because that's just gone.
That's the part of our cognition that's not working, is that
Correct. And
thinking it through. And
yes, and my learning opportunity was this. The more that I tried to correct her thinking, the more her upset increased. Now, being hard of hearing, I kind of have to yell for her to hear me. And yelling is not in my nature. I didn't grow up with it. And when you yell, your whole physiology tends to amp up, or at least mine did. So she's escalating. Now I'm escalating. She's now reacting to me, and this was my opportunity for improvement. And in looking back on that learning moment, what I realized was, Rose, what was the big deal about when she takes her pills? Why didn't I just say, okay, Mom, when do you want me to bring them to you? And just set them down for her, because ultimately it was not that big of a deal. I allowed it to become one.
So you learned the importance of so what and go with the flow.
Right.
And really checking in with yourself to verify, is the problem really a problem?
Who
or
cares?
is it annoying
Who
that
cares?
she's changed the rules and my logical brain wants the rules
That
to be the
was
rules?
my
Because
learning
that
moment.
was okay.
And
cool.
interestingly enough, 2 days later, she reverted right back to I take my pills at night, and then the whole problem. What a learning moment. What a learning moment. Who cares? What's the big deal?
Yeah.
What am I getting upset about?
Huge. How about either of you, communication style shift and change to match the person, or not so much?
My grandmother never cursed, and forbidden words were still
Forbidden.
there, and we were raised in a Christian household. We never heard her curse. So when brain change happened and those words were left and she would get really upset, they were just flowing, and there was a lot of embarrassment. I didn't know then what I know now, and so there was a lot of correction, and she would escalate, and I would say, calm down. Why are you so... and later in life, I learned through you that that's one of the worst things you can tell someone that is in that moment.
So you're making me wonder, Mary. Early on, you used the word violent to describe your grandma. I'm wondering how much of her violence came from people trying to make her be different than she was able to be, because she was already doing what she could do.
Yeah. our reaction to her brain change caused outbursts. I would have left the house too. I would have wandered away from all of us.
Wandered or left?
I would have left. I would have tried to find home.
Yeah, so labeling it as a behavior on that person's part, but not seeing the other side of the story of what led to that.
Yeah.
Yeah, and so describing sort of people's reaction to her reaction of being loss of words. I can't find the thing and I'm not the stupid shit.
Yeah.
I mean, you know,
Yeah.
coming up with the word shit.
Yeah.
And just being surprised that she would do that and rather going, wow, she's really upset because what she's showing is how emotionally distressed she is. But not understanding that and thinking it's a choice. How long do you think it took before your grandfather, if he ever did?
He never did. We
He
never,
never
did.
did. You all never did
No.
with her.
When I became a professional caregiver, I had a situation where I had to just go with the situation. And if I kept bringing them back to my reality, it was going to be dangerous. And so I learned later through education that to just go with it and to be in the moment wherever they are.
Go with that flow.
Yeah.
Yeah, so reality orientation versus go with the flow, using logic versus does it really matter in that moment? For Crystal, how about for you? Moments of learning for you in this process?
I think for me, I was disappointed because once he was diagnosed, the same things he was doing before he was diagnosed are the same things he was doing when he was diagnosed. And so we'll say the sky's blue, and he says the sky's green, and we say, no, it's the sky, and he would just argue back and forth. He did that before he was diagnosed. Again, we're different.
His whole life or?
Yes.
So in this situation, we have someone who had a pattern their entire life of wanting to be right and being whatever he said was the way it was. So you had a really hard time recognizing the difference between who he'd always been and this worsening of the symptoms with the dementia.
Exactly.
Yeah, so it's hard to let go of it, sounds like.
Yeah, and it was hard.
Even after the diagnosis.
Yeah. So it was difficult because, again, you couldn't tell. It's like he was doing this already. He was, and so it became after a while like a aha moment that, me being in education for over 20 years and working with students with disabilities and so on and so forth, I should have caught that. So, hindsight is 20/20.
Oh, I shoulda, woulda, coulda.
I know. But now he says the sky's green. Yes. We don't fight with him about anything. But in our culture, and I was listening to you, the best way to communicate with him is to call my daughter, is to call my son, is to call my niece. And those are the only people he's going to listen to if you want to tell him something that's important, such as taking a shower, things like that.
Could you do me a big favor, Grandpa?
Yeah.
Yeah.
Well, my daughter usually says, I'll buy you, they'll buy you Bojangles. And I'm like, are you giving us the money to buy all this? She was like, you need to give him incentives. Yeah, but on my budget, But that has worked. That has worked.
So when you all have been in this role of child caring for parent, how many of you, and you have kids or no kids?
I have 3 children.
You have 3 kids. Kids? No kids. No, you were a grandchild.
I have 2 kids.
Okay. How many of you, without thinking about it, found yourself moving into, what did I tell you, Dad? We aren't going to have this conversation. Moving into the parental role versus the kid. Have you ever found yourself saying the words that you heard a parent say? Parenting your parent, sort of like you're raising kids, or did you skip that? Not have that happen?
I have not had that happen. I keep catching myself trying to be her hero, her rescuer. and that doesn't always work well, you know.
So if you scoop in and start fixing things for her, what's wrong with that when you realize it?
It
What do you recognize?
disempowers her.
Oh, it takes away her
And there's
power.
always reward in accomplishment. And I don't think that as human beings we ever lose that. We have to feel productive and we have to feel effective. And when I would try to rescue her from a problem, that was probably the wrong solution. And so I had to begin not thinking of myself as her hero or her rescuer, but rather her partner, her helper. You know, something as simple as trying to open a bag of cereal, and we've all been there with those things are hard to open. And I know with myself, if I'm struggling to open something and my husband comes in the room and just tries to take it and do it for me, you know, I'm working on it. I'm mad now. I'm going to get this done. We like to feel accomplishment.
Yeah.
And it was wrong of me to try to take that away from her. It was better if I say, try these scissors, Mom.
Try this.
Or let me get that started for you, and then let her experience success, because we all have to experience success to feel purposeful.
For me, they say I've always been bossy. So it wasn't a problem. You know, he was used to me being bossy, and he was used to me telling everybody what to do and where we're going and where we're traveling and how long. So I just slid right in.
You slid in.
So
Yeah. One of the things when you have that moment, when you're interacting, trying to support somebody and they're doing something and you find yourself being surprised or frustrated by what's happening, and it's like, ugh. Have you tried that word, wow? Wow. Wow, Dad. Blue. Huh. So the floor is blue. Wow. As opposed to, yeah, Dad, it is. It's a different take on it. I'm just curious, would that ever occur rather than what we call, I'm just going to call it for what it is, lying, because sky's not green. But you don't have to say the sky is green, but you can say, wow, Dad, sky's green. Huh. Isn't that interesting? Has that ever before, right now, come into your mind yet?
I think I've done two things. Yes, I think I have lied. It's worked, but I like what you just said about saying, you know, wow. But again, in our culture, it's easier if you're helpful. So it doesn't seem like you're taking away the power. It's like, oh, let me help you with that, you know. And so for me and some things we do lie. You know, like when he packs up his clothes and says he's going to the gym, you know, and I'll say, okay, well, let me finish my food and we'll go later. You know, I'm not going later. So it's still lying. It works.
It does. It does.
I have never had a problem with compassionate lying. Never had a problem with it because the motive behind it is appropriate.
What's the difference between saying we'll go later and we can go later? What's the difference? We can go later.
What drives the difference is probably his response to it.
Well, but if I say we can go later versus we are going later, what's the difference?
Nothing.
Yeah, it is.
Because he's not, well, for
One's
me.
a lie and one isn't.
Both of them are a lie.
No, we can go. I mean, I'd be willing to drive you later.
Yeah.
It's true.
But I'm not at 10 o'clock at night, you know.
Yeah,
that's
but
when
we could.
he wants to go.
We
Yeah.
could go.
Yeah.
We could go later.
I guess I'm saying in my case, he won't remember 2 minutes later what you said, so it doesn't even matter.
Has
You know.
anybody ever had someone remember and you think they won't?
Oh, yes.
And they do.
Yeah.
Oh, yes.
I haven't.
Oh, you haven't had that yet. So tell me about that, Mary.
I haven't.
What happens when they do remember and you don't think they will?
They almost fixate on that answer, and so then they continue to come back to you and say, "Hey, I thought we were doing this," and they may not even have all the words, but
The
you
bag
know
is
what
in
they're
their hand
referencing.
and they are at the door
Yes,
with the keys.
it's time. You said later. It's later. And sometimes for days they remember that. And
Yeah.
so you kind of get in this sticky situation and you're
Yeah.
deeper in the, what, we
Muck.
might call lies, because you have to keep on distracting and redirecting. So.
Mhm. Yeah. So you've had some moments where mom has actually remembered something you thought
Correct.
she would have
For a
forgotten.
period of time,
Uh-huh.
before I took a stronger control over her medication regimen, she was managing her own
Mhm.
meds. I did not know that she was doubling up
Mhm.
on the amount of Elavil that she was taking. And for that reason, she ran out of her 90-day dose
Mhm.
halfway through.
Right.
Well, when you come off that medication, it can affect you.
Mhm.
And so on a Friday night, she kind of, I'll say, went off the deep
Had
end about
symptoms.
that particular
Mhm.
medication. It was gone. This being Friday night, I was, again, trying to explain logically, well, there are things I have to do. I have to call the doctor. I have to get him to give me an emergency script. His office opens Monday, so there's nothing we can do until then. Well, she wasn't hearing that. Being Friday evening, I just said to her, okay, Mom, I'll take care of it tomorrow morning. She goes to bed. The next morning, she gets up dressed, purse in hand, ready to go to the pharmacy. Because in her reality, well, if you need your meds, you go to the pharmacy. They'll know what to do. Can't do that, Mom. So I try to explain again. She's not hearing it again. And she's got her bag. She's going to drive herself, if nothing else. I didn't know what else to do but go to the pharmacy and let them tell her what I knew they were going to tell her. No, she did not forget.
Yeah. And so that's one of the tricky parts about how we try to support somebody, and how sometimes we think we're okay because they'll forget or it won't matter. And then it does. And so that art of wow, huh. Well, I never. Isn't that something?
But, there was learning in that too.
There is. When you were getting the diagnosis, you were getting it identified, and yours is still vague. Yours is cognitive impairment. You have FTD, and your grandmother was with Alzheimer's, young onset, though.
Yeah.
Yeah. The emotions immediately before the diagnosis and then after the diagnosis, for you and for them. What happened emotionally
Lack of surprise
for you?
for me.
What about your
Because
mom?
my mother has a twin sister
Mm.
who got a cognitive diagnosis about 2 years before. And so I think in my mother's own mind, she was kind of preparing for it. She was not surprised.
She wasn't surprised either.
Correct.
So it was an affirmation of what you were already feeling. And the feeling was
A little bit of fear
fear.
of the unknown.
Okay.
But we had tried to have something of a plan in place ahead of time. So
Okay.
certainly,
Planning ahead.
fear was probably the biggest one.
Sadness?
Uncertainty, a
Depression?
little bit of a grieving process because we kind of knew what we
Affirmed.
were in for, so to speak.
Yeah. So have there been other family members who have the kind of cognitive impairment your mom has, so you've seen it advancing, or just her sisters advancing?
Just her identical twin sisters, who's
Okay.
at this point nonverbal.
Okay. All right. So she sort of, that's her vision of what comes next. Okay. And yours as well.
Yes.
Okay.
We were in the mountains of Virginia, and the doctor never really diagnosed her. We heard Alzheimer's, hardening of the arteries, memory loss. It was nothing very specific. There was a lot of grieving. I remember crying over, like, the first time she lit a pan on fire on the stove, and all I could think about was I'd never have homemade biscuits again. And then I was really angry at myself that I was worried about biscuits. And then later I realized I was just grieving every loss and what made her who she was. We watched our grandfather just become a shell, and he didn't talk about it. The only thing he would do was beat around pots and pans early in the morning, and that's when you knew it was a tough night. And so there was a lot of sadness and grief. I felt like we had lost 20 years because she was in her 60s, and it's just still very raw that we didn't have those years. And so, the sadness really never left, and that's why I became an advocate.
Yeah. Yeah. You said that the family was a strong faith community family. Did the faith community step forward, and did she stay active in the faith community, or was that
No,
not with the
no,
changes?
no one really knew what to say because of her cursing and
Mhm.
different things, her responses. We didn't really take her to church anymore because of those responses of
Mhm.
church members. And I became really angry because she took care of everyone in our community.
Mhm.
And I felt like everyone just left her.
Yeah.
And a preacher came in once and she cussed like a sailor and he became wide-eyed. And
Yeah.
we had watched her older sister go through early onset
Mhm.
and be placed in a facility
Mhm.
because she had no kids. So it was this very just terrifying
What was
situation.
gonna happen?
And my grandmother was always anxious. And
Mhm.
so now I understand that her anxiety was taking a toll on her throughout brain change. And that's what she was
Mhm.
responding to.
Mhm.
And I always say I didn't do the best job as a caregiver. I did the best I could with what I had.
Yeah.
But now when I talk with families, it's like those old hymns and the things that calmed her for a lifetime, I could have utilized those a
And
little bit
those
more.
weren't tools
No,
that anybody recommended or to
no.
use, because that rhythm section is stronger. Just where the swearing was coming from also has
Yeah.
the prayer and the music.
Yeah.
Yeah. Hmm. How about prayer and music and comfort and
The good thing about my dad is he's always been a jokester. Always laughing, always making jokes, always telling you these crazy jokes. So everybody is used to him laughing. So when he got diagnosed, everybody was like, but what? So for us, it wasn't, we should have, could have, like I told you. It was more of stepping back, looking back, and making decisions to move forward. And as much as my cousins and everyone want to see him like he usually is, funny, laughing, because my aunt would come over my house and say, he seems fine to me. I said, okay, come stay with me at 1 o'clock in the morning. So for us, it's like, okay, we can't worry about what happened those years. We need to work on it now.
so accepting your support and help, being accepting of your help. What do you notice about your person's ability and interest in getting help from you? Whether it's figuring out the checkbook or putting clothes on or taking a shower or needing assistance to eat, needing assistance to move, wherever you are. What have you noticed? Has there been pushback or pretty much, oh, yeah, sure, that'd be great? What have you noticed about that relationship?
in my dad's case, he couldn't use the cell phone, and my daughter would say everybody needs a flip phone now because nobody knows how to turn it on, unlock it, and so if you took that from him before, he would have snatched it back and say, I can do it. Now I'll say, well, let me see it, and I'll fix it. He gives it to me, and he says, wow, y'all are so fast at this.
So you get grace.
I get some
You get some grace there.
Except when I
because-
say it's time to take a shower.
Uh-huh. Yeah. Yeah. You take your shower. That's
Yeah.
fine. I don't need one. Uh-huh. Yeah, that's pretty intimate task that we're asking permission to take on.
Yeah.
Yeah. Yeah.
Well,
Sometimes
he
I
has
thi-
a wife to worry about that, so.
Uh-huh. Uh-huh. Still intimate. Anybody else?
What I've noticed with my mother, and it's consistent with the person that she's always been, the things that she loved and valued: yard work.
Mm-hmm.
Never cared much for housekeeping indoors, though she would do a good job of it. Never cared much for that. So she was,
Letting go
it
of
appears,
that.
perfectly content to let me
Take over
take
that.
over the checkbook, getting the dishes done, all that
Yeah.
stuff. She's a little more hard-nosed when it comes to that yard work. And if she takes an approach to her yard work that doesn't seem to make sense to me, like cleaning leaves out of the ditch, you would go get a rake. You would go get a rake. She'll get down there on her knees and use her hands. And at 89 years old, brother, she can do it.
Good for her.
I leave it alone
Uh-huh.
because the decision that I kind of made with her is my ultimate goal for her freedom from distress.
Mhm.
That's all I want.
Mm.
So that's kind of become the lighthouse
Mhm.
of the decisions that I make with her. Is this hurting her or anyone else?
Right.
And is it bringing her happiness?
Mm.
And if that's the case, I just leave it alone.
Mm.
Because if I
Mhm.
try to get involved in it, Mom, try using this rake. I'm fine. I'm fine.
She'll do it more aggressively.
Correct.
Yeah. Mary?
My grandmother always took care of everyone in the house and the cooking, and our response to it was, after brain change was, "Look, we'll do it. We got it." And she wasn't having that. And now I know that I should have let her be more independent and focusing on the small tasks. And you could see her face when women were in her kitchen. I mean, she was like ready to, and I would be too, and I understand that better now. But my grandfather often would just like take the clothes, and, it was a lot of aggressive movements. And then she would respond aggressively. So it was just this back and forth type.
Well, I want to say thank you to all three of you for being here today, for sharing your story, for putting out there what you've shared so others can learn and become perhaps a little better at what they're doing when they're called and to decide it's for me, it's not for me,
Yeah.
but to be present with someone who's living with the brain changes. Thank you all.
Thank you.
Thank you.